Sure. Here's an emotional and inspiring short story based on the title. Elizabeth Warren vs. Rick Scott, Healthcare Reform Approaches. Jenna Moreno stood outside the county hospital in Tallahassee, her 5-year-old daughter Mia's tiny hand gripping her coat sleeve like a lifeline. Mia's cough had worsened overnight, and the faint rattle in her chest now sounded like a warning bell Jenna couldn't afford to ignore. But with no insurance and barely enough money for groceries, every trip to the ER felt like stepping into a courtroom where poverty was on trial. Inside, the fluorescent lights buzzed softly. Jenna signed the clipboard with shaking hands and sat on a cracked plastic bench, gently rubbing Mia's back. All around them were others, tired mothers with babies, elderly veterans clutching folders of medical history, young men in work uniforms clutching their ribs, limping. Each of them was waiting, not just for care, but for mercy. Across the country, a political battle was brewing, one that neither Jenna nor the others in the waiting room could escape. Senators Elizabeth Warren and Rick Scott had taken center stage in a high-stakes debate over healthcare reform. To the media, it was politics. To families like Jenna's, it was survival. Elizabeth Warren, driven by her own childhood memories of watching her mother struggle to pay medical bills, pushed a plan grounded in empathy, universal access, expanded public coverage, community clinics, and a focus on preventive care. Healthcare is a human right, she repeated on every platform. Her opponents scoffed, saying it was unrealistic, too expensive. Rick Scott, with his background as a hospital executive, championed a market-driven approach, lower premiums through competition, limited government involvement, and personal responsibility. You can't fix a system by burying it in bureaucracy, he told the Senate. People need choices, not mandates. The news networks turned their clash into primetime theater. But in hospital corridors, the cameras didn't reach. 2 weeks after Jenna's ER visit, Mia was diagnosed with early-stage pneumonia. The antibiotics worked, but the bill was brutal, over $2,000. Jenna tried to negotiate, then cried silently in her car after the hospital refused to reduce the charges. The insurance she once had through her job at the diner vanished with the pandemic's layoffs. Her part-time gig now offered no benefits. And the state aid she applied for? Denied. Again. Desperate, she found herself writing a letter, not to her representative, but to both Warren and Scott. She never expected either of them to read it. She didn't write for pity. She just needed to feel heard. She wrote. My name is Jenna Moreno. I'm a mother, a worker, a citizen. I'm not asking for handouts. I just want to be able to take care of my daughter without having to choose between her medicine and our meals. Please, for all of us. Stop fighting each other and start fighting for us. S.H.